Hello, you are welcome. So today we are discussing the differences between nasal polyps and nasal turbinates, the inflamed nasal turbinates, how to differentiate them. Okay, now before we go any further, let's talk about the nasal cavity. So we are saying the nasal cavity extends from the nostrils to the choana, which leads to the nasopharynx. Okay, so it is divided by the midline of osteocartilaginous septum. Okay, so the roof is formed by the cubriform of the plate of the ethmoid bone. The floor is made up of the hard palate, which is constituted by the palatine plates of maxilla and horizontal plates of palatine. The lateral walls shows the main ridges called the superior, middle, and inferior turbinates. Okay, so what are the functions of the nasal turbinates? Okay, functions of the nasal turbinates. So number one, warming the air. Number two, humidifying the air. Number three, filtering the air. Okay, there could be more functions of the nasal turbinates. Okay, so now what are nasal polyps? So we are saying nasal polyps, these are painless, non-cancerous growths on the nasal passages or the sinuses. So these are nasal polyps. Okay, they are growths that are non-cancerous. Okay, now let's look at the diagram which shows the nasal cavity innervation, showing the turbinates. Okay, so this is the diagram of the nasal cavity, as you can see. Okay, so the cubriform plate of ethmoid bone, the sphenoid sinus, the sella tussica, the choana, the pharyngeal tonsils or adenoids. Okay, the opening of the eustachian tube or the auditory tube. There's an uvula there. Okay, the soft palate, the hard palate, anterior nares, vestibule, and the turbinates that we are talking about. So these are there's an inferior turbinate, the middle turbinate, and the superior turbinate. So sometimes these turbinates may get inflamed. Okay, they may hypertrophy. Okay, remember the turbinates are part of the nasal cavity. Okay, so now this diagram shows the nasal cavity in which there is a growth, which we call a nasal polyp. Okay, the nasal polyp, the one that is looking whitish. Okay, the nasal polyp is looking whitish there. Okay, so that's a nasal polyp. Okay, that's a diagram. Yeah. So now, how can you differentiate if these nasal turbinates they get inflamed? How can you differentiate between nasal polyps and nasal turbinates hypertrophy? The differences. What are the differences? Okay. So saying in color, the nasal polyp will be looking pale. The nasal turbinate will be looking pink. Okay. Then when we come to sensitivity to probing, the nasal polyp will not be sensitive. The nasal turbinate will be sensitive, so the patient might feel some pain. Okay, if you probe. Consistency, it is the nasal polyp is soft, the nasal turbinate is hard. And when we come to mobility, the nasal polyp is mobile, while the nasal turbinate is not mobile. When you use a decongestant, say decongestant test, okay, so when you use a decongestant, for a nasal polyp, there will be no change. For a nasal turbinate, which has a hypertrophied when you use a decongestant, it will shrink in size. It will become small. It will reduce in size. So these are the differences. Okay, so the color, nasal polyp pale, nasal turbinate pink, sensitivity to probing, nasal turbinate not sensitive, nasal polyp not sensitive, nasal turbinate sensitive, consistency, nasal polyp soft, nasal turbinate hard. Mobility, nasal polyp is mobile, nasal turbinate not mobile. If you do a decongestant test, there will be no change in the nasal polyp, while in a nasal turbinate, it will shrink in size. So remember, this channel is not a substitute of school and the hospital. Until next time, bye bye.